Namaste viewers, welcome back to Homeeo Healing with Harmony. So this is another podcast, as I mentioned to you, podcast number 3, which will help us delve into the world of homeopathy and holistic health. I'm Anchor Rashmi Prabhu and I have with us Dr. Anusha Kulkarni from Homeeo Healing by Anusha Kulkarni Homeopathic Clinic. And today our topic will be dealing with women health. Ma'am, namaste and welcome back.
Thank you.
Yes, ma'am. As I mentioned to you, we are talking about women health, and I've had a lot of female friends suffering from different types of women disorders or diseases.
True.
So, can you mention to us what are the major types of disorders or hormonal issues which our female friends or colleagues might be going through?
So true, Rashmi. So nowadays we are seeing so many women coming up with the PCOD condition, thyroid disorders mainly. So usually we see 3 phases in our life. Okay, one is Menarche, next comes the pregnancy, next comes is the menopause. So during Menarche or post Menarche till pregnancy, what happens means the pivotal age group, what we call, no? So the reproductive age group. So that time nowadays, because of a lifestyle, one more thing is like because of major stress factor what everybody we are going through. So majorly we are coming up with a condition called as PCOD or PCOS. PCOD means it's a polycystic ovarian disease. OS means a symptom, means syndrome, which is a combination of some other issues. It's a cluster of symptoms, I can say. So this is have become very common nowadays. Almost 9 out of 10 girls or women are going through these issues. So it might be the early menses what they see, or it might be the delayed menses. Some girls, they say that, madam, it's been 3 months, 4 months, I didn't even get my cycles. So and along with the irregular menses, one more thing what they notice is like they go come up with a hirsutism. Hirsutism means unwanted hair growth on the facial hair growth what they see. That is one thing. So another thing is like they come up with the obesity and weight gain. So weight gain, all of a sudden my weight got increased 5 kgs, ma'am, I don't know the cause, but since few days I am observing, few months I am observing ki I have got there is irregularity in my cycles. So they usually come up with these complaints. More symptom what we see is with the acne.
So pimples and acne.
True. There are 2 types of acne what we see. One is acne vulgaris and one is acne rosacea. So any kind of pimples what they come up is because of hormonal fluctuations. So again, when again coming back to our episode 1 what I explained, So hormonal imbalance is a major concern for every conditions whatever we are facing these days. So here what happens, some because of our too much of eating outside foods, which is mixed with so much of chemicals,
oil,
different oil and tasting agents, I can say. There is one thing called as monosodium glutamate, what we call it as the Ajinomoto, which will cause so much of impact on our health. So these conditions, if not treated at a proper time, will lead to a different condition called as PCOS. OS means, that's what I said, cluster of symptoms. It is a syndrome. Syndrome along with few symptoms. See, in PCOD what we see is only few symptoms related with the menstrual cycle, along with the pimples and hair fall, other things. PCOS, sometimes it might be accompanied with thyroid disorders as well.
I see.
So if not treated at a right time, they may end up with some other issues further, like infertility post marriage. So before marriage only, many girls will have to treat this completely. Otherwise, they may end up into primary infertility, or sometimes they may have a first child, but after that they may end up with the infertility called as secondary infertility. So these are the common conditions what we are seeing nowadays. The main thing, girls or the women, they are coming up is with thyroid disorders or the hypothyroidism, or some maximum every girl they are going through this condition called as PCOD.
So, talking about PCOD in detail, how do you have your patients coming up with problems like related to PCOD and PCOS, and how have you been treating them?
So usually what happens, they will not see, as I mentioned, no patient comes to homeopath for first time.
Right.
So nowadays almost everyone, they are aware of what they are going through.
Correct.
Because it's because of too much of research they are doing and Google knowledges they'll be having. So what happens, whenever they come up with any issues in the menstrues exactly. So and there is one idea they have is like, it's not like every woman is alike.
Right.
Every woman is different. Like I can say, few girls or few women, and they may get their cycles exactly on the 30 days. Few may get it on 24 days or 27 days. Okay. But that is not considered as the PCOD. Associated symptoms along with that, along with this few other signs and symptoms, when thoroughly examined, or when we send them for the investigation, when we see the ovaries has been with a cystic, means the cyst, every month the cyst is formed which has got a egg.
Right.
Okay. And there is a process. Okay. Then eggs get released, fertilization happens, and then grows into if not, it sheds out along with the endometrial layer in the form of menses.
Right.
Some people, they come and they ask me, madam, only 2 days delay I got, is it a PCOD?
Okay.
No, that is not an issue. Okay. Associated like hair fall, if hair fall is there, unmonitored weight gain is there.
Okay.
For example, if you are weighing somewhere around 62 this month, or 2 months back, all of a sudden your weight increases by 67 2 months later.
Okay.
And you crave for too much of sweets. You feel lethargic when you wake up in the morning. You don't feel like freshness.
Energetic, right.
Energy. So there are certain other symptoms also, tiredness, weakness, and there one more main factor what we are seeing nowadays is mood swings.
Absolutely.
Obviously, mood swings very common with the girls and women. But in these cases, what happens is the mood swings is so high that chirchara, what we call irritation. They don't want to do anything. They just want to lie down, or they just want to left alone. They even don't want to interact with any other. So these are the conditions what we have to rule out. So how we help them is like, so for any conditions, any disease condition, so we have to rule out what is the causative factor.
Okay.
It might be a prolonged stress. As I said, nowadays almost school girls, they are going through so much of stress because of their work style, studies and other things. Pressure from school, pressure from parents, teachers, everywhere.
Peer group.
So because of that also, they wanted to do something, but they are not they're not planning their day properly.
Right.
If you ask me.
Right.
If they are planning also, too much of studies or other things, they are into extracurricular activities, that is impacting their life. So ultimately that is impacting their hormones as well.
Yes.
Because once you take too much of stress, there is release of one stress hormone called as cortisol, which will fluctuate each and every hormonal balance. What I can say. So because of that, they end up with a hormonal imbalance. It's not just PCOD, thyroid, sometimes the other conditions like obesity, where they are lacking physical activities, lifestyle issues bhi hai, or along with that, these other causative factors, like sometimes they say, my mom had this thyroid issues. Of course, some diseases, they are congenital as well. But it's not like every time we should blame our parents that my mom had this, we are getting this. No, because main thing is, why only you're getting? Why not your other sibling?
Right.
Isn't it? So that also we should rule out. Why only this condition is being caused? The root factor, what we treat, that will help in complete cure.
Okay. So you mean there would be some minor symptoms that could lead to a major ones, but also it could also depend on the lifestyle as well. Definitely. Right? Not only hereditary issues, but lifestyle as well.
True.